Hello everyone, welcome to our briefing. This briefing is presented by WorldAware. WorldAware provides intelligence-driven, integrated risk management solutions that enable organizations to operate globally with confidence. WorldAware's end-to-end tailored solutions, integrated world-class threat intelligence, innovative technology, and response services help organizations mitigate risk and protect their people, assets, and brand reputation. Before we get started, I'd like to go through a few housekeeping items. The briefing is being recorded and will be provided to attendees after the call. All attendees will be muted throughout the briefing. You can submit questions through the questions pane on your attendee control panel at any time. All questions will be held until the end of the briefing. If you experience technical issues, please let us know through your chat pane and someone will assist you. Our speaker today is Adam Prusakowski. Adam serves as an intelligence analyst on the Middle East and North Africa team. He has spent 21 years residing in and traveling throughout the Persian Gulf region and is a graduate of the University of Edinburgh, where he studied international relations, focusing primarily on the Middle East and the Persian Gulf. Adam is going to discuss the recovery and response efforts we're seeing in the Middle East currently. Adam?
Thank you, Mary. Good afternoon and good morning. So at WorldAware, we have developed 4 potential medium-term scenarios to demonstrate how governments in the MENA region will likely respond to the COVID-19 pandemic in the near to medium future. These scenarios are health first, so this is where a government prioritizes the health of the public over that of business activity. In a sense, this is a lives over livelihood situation where there have been significant business restrictions, but it stems the spread of the disease and helps to flatten the curve. Incremental normalization. This is where essentially a government is slowly rolling back restrictions in an effort to restart normal economic activities. However, there will still be some disruptions to businesses. This is what we believe is the best case scenario. Business first, this is where government rolls back restrictions too quickly or does not have sufficient restrictions to prevent additional outbreaks or stem second or third waves. And lastly, no normalization. This is where government and business restrictions remain in place. The main difference with this scenario compared to the health first scenario is that the public is not supportive of such measures, which can lead to growing political disobedience and civil unrest. We will utilize these 4 scenarios to explain how the pandemic may play out in Saudi Arabia, the UAE, Israel, Lebanon, and Iran over the next 90 days. However, before we get into the case studies, I think it's important to preface that COVID-19 is an unprecedented event and no country will follow a linear path. So with Saudi Arabia, it's been one of the most consistently and most proactive Gulf monarchies in its response to the disease. Authorities were quick to implement lockdown measures and continued to do so. They suspended international travel and significantly improved their medical infrastructure. While authorities have lifted some lockdown measures, such as the shortening of curfew hours nationwide, or which may suggest a shift toward an incremental normalization policy, many other parts of the kingdom remain under lockdown. There is a strict nationwide curfew, and inter-provincial travel remains limited to trade and essential means only. So given this, we rate there is a 50% chance that the kingdom will maintain its health first policy in the next 90 days. Our reasoning for this is there's a historical precedent of Saudi Arabia being proactive in responding to viral diseases. In the 1990s, for example, authorities banned Muslims from several African countries from attending the Hajj pilgrimage due to an outbreak of meningitis. And similarly in 2015, Muslims from the Democratic Republic of the Congo were prohibited from attending the Hajj due to an outbreak of Ebola. And of course, most recently in Saudi authorities prohibited the Umrah pilgrimage from taking place as well. So Except for the kingdom's restive Shia enclaves in the eastern province, such as Al-Qatif Governorate, the government still has broad public support for its health first policy, and citizens have rallied behind the so-called "we are all responsible" mantra, which means that significant forms of unrest are unlikely to take place and pressure the government into prematurely lifting its health first policy. There is a possibility that Riyadh will enter the incremental normalization scenario. Ultimately, the kingdom cannot afford to indefinitely maintain its health first approach, and COVID-19 has prompted low oil prices, which is Saudi Arabia's economic lifeline, for example. And as recent austerity measures, such as the tripling of its value-added tax and the suspension of some subsidies for public sector employees demonstrate, a gradual shift toward incremental normalization is likely to be the next phase. So depending on infection rates, we rate the kingdom has a 40% chance of adopting incremental normalization as its next policy. And the indicators we're monitoring for the kingdom include, of course, medical data. If case numbers begin to rise or steadily and gradually fall, we'll likely see either internal movement restrictions being lifted or the reimposition of more restrictive measures. And moving on to the UAE, the UAE, like Saudi and more broadly the Gulf region, has been proactive in enacting various restrictions and health measures aimed at preventing the spread of COVID-19. At the outset of the disease, the country was very much in a health first scenario. So authorities deployed contact tracing, mobile and drive-through test centers, mandatory quarantine periods, and even closed the country to international travel. However, it has become increasingly clear in recent weeks that the Emiratis are adopting an incremental normalization approach. So we've seen authorities partially lift lockdown measures, allow non-nationals to fly into the country subject to prior approval, and they've also reopened various businesses and outdoor recreational activities such as private beaches. So therefore, we have given the UAE a 70% chance of continuing with its policy of incremental normalization. And the indicators we're watching for the UAE include, of course, medical data. We'll also be monitoring whether the government will continue to ease restrictions. We believe this is a key indicator of how well authorities are controlling the disease as we see some return to normalcy. And we'll also be monitoring announcements from flag carriers Etihad Airways and Emirates Airlines. Both airlines have consistently released statements indicating a potential date for the resumption of normal operations subject to governmental approval. And most recently, both airlines have announced the resumption of some regular and non-repatriation flights to destinations across Europe, North America, Asia, and Australia. So depending on government approval and disease activity, additional destinations are likely to be added over time. And if we move on to Israel, Israeli authorities initially were very strict in implementing restrictions and regulations in an effort to curtail the spread of COVID-19 in the country. And Israel's quick response and far-reaching public health policies have made it possible to begin easing restrictions and resume some normal economic activity in late April. So the government, for example, introduced specific requirements for businesses to reopen, including the wearing of mandatory face masks, daily temperature checks, and regular sterilization of shared public spaces. So given this, we believe there's a 70% chance that Israel will continue with an incremental normalization policy over the next 90 days. And our reasoning for this is Israel is currently treading a very fine line between preserving public health and mitigating business impact. Authorities have begun to ease COVID-19 restrictions amid a continued decline in new cases and are allowing businesses to reopen and public transport to resume, albeit of course with specific health guidelines and with things such as social distancing. Moreover, authorities have adopted clear and transparent conditions for the possible reimposition of COVID-19 related restrictions. So if cases or patients in a serious condition begin to rise significantly, Israel will reverse its policy of the easing of restrictions. Moreover, the country does have a very robust medical infrastructure, which has allowed authorities to effectively test, trace, and treat cases. And authorities have also declared lockdowns in specific towns and neighborhoods where there's a significant uptick in cases. And ultimately, the identification of COVID-19 hotspots has enabled authorities to gain a greater control over the spread of the virus. And with the exception of ultra-Orthodox communities who have been defying bans on gatherings and other restrictions, the Israeli public in general broadly supports the government's policies. So the indicators we're watching are, of course, medical data. As mentioned, a significant uptick in cases could lead to business closures and the reimposition of movement restrictions. We'll also be monitoring international travel restrictions. So if the Israeli government allows a resumption in flight activity or reverses the ban on foreigners entering the country, we believe this will constitute a return to near normalcy. And also, we'll be monitoring if the government declare additional restricted zones. So the identification and isolation of COVID-19 hotspots has helped to combat the spread of the disease. However, prolonged lockdowns may lead to an increase in public unrest. And if we move on to Lebanon, in Lebanon there have been widespread business closures and rising unemployment as a result of the pandemic. And this has only served to further exacerbate the public's pre-existing economic grievances and increase the potential for civil unrest. There have been ongoing anti-government demonstrations condemning alleged corruption and economic mismanagement in Lebanon since October 2019. However, protests have only grown in intensity due to the aforementioned reasons, and this is in spite of various COVID-related restrictions being in place. So we rate that Lebanon has a 40% chance of continuing with the no normalization scenario in the next 40 to 60 days. Our reasoning for this is, of course, there's widespread dissatisfaction with the economic impact of COVID-related restrictions in the country, and the anti-government demonstrations, which had rarely been violent before, have suddenly become a bit more hot. And ultimately, the country's dire economic situation has forced the Lebanese people back onto the streets. So the additional economic hardship caused by COVID will likely lead to additional nationwide unrest. Also, as one of the most indebted countries, the government is poorly equipped to formulate an effective public health response to COVID-19. And ultimately, the pandemic has only compounded the issues faced by Lebanon's government and further strained its limited resources and currency reserves. So We have given Lebanon, as you can see, a 30% chance of entering the incremental normalization scenario. Authorities have approved a phased easing of COVID-19 restrictions through June 8 to allow for the gradual resumption of economic activity. Public transportation and some select businesses have been allowed to resume with certain measures in place. However, authorities have warned that the easing of these restrictions will be reversed if the public continue to breach precautionary measures, such as the avoidance of gatherings and, the refusal to wear face masks. Additionally, of course, authorities also extended the nationwide nighttime curfew amid an uptick in COVID-19 cases. So the indicators we are watching for Lebanon include, of course, medical data. A marked increase in COVID cases could and will likely lead the government to reimpose restrictions. And another factor we'll be monitoring is IMF or International Monetary Fund support. An IMF plan would help Lebanon secure desperately needed financial assistance, and it would help relieve some of the negative economic effects caused by the ongoing crisis in the short term. But the austerity measures that are almost certain to accompany any IMF assistance would likely increase in the medium to long term. Moving on to Iran. So Iran has been the region's COVID epicenter with the highest number of cases, and authorities have consistently refused to implement full lockdown measures due to economic challenges. Whilst there have been some, restrictions in place for high-risk businesses such as restaurants and gyms and theatres. Because of economic necessity, authorities haven't had to basically lift restrictions on things like in-city travel, and they permitted shopping malls and bazaars and souks to reopen nationwide in mid-April. Though when the reopening did happen, health officials did raise fears of a second wave of infections, as the country ultimately at that time had not effectively contained the disease. So given this, we rate there is a 70% chance that Iran will maintain its business first policy in the next 90 days. And our reasoning for this is, Iran's measures have consistently been less restrictive than its neighboring countries. For example, Iran hasn't introduced a curfew like many other countries in the region have done so. And also, officials stated that the decision to reopen shops and businesses nationwide was an attempt to boost the economy, which has been suffering under American sanctions. And of course, when businesses did reopen in April, there were still over 1,000 recorded daily cases of COVID-19. There are some attempts at incremental normalization. This is why we've given it a 20% chance. And the Ministry of Health has divided the country into 3 zones, a white zone, a yellow, and a red, depending on the COVID-19 fatality rate and the extent of the outbreak, whereby white is the lowest threat. And in white zones, authorities have allowed mosques to reopen, which of course during the holy month of Ramadan is a very important factor. And also authorities have also reinstated localized lockdowns if there are, a significant uptick in cases, such as in Khuzestan province. So the indicators we're watching for Iran are, of course, medical data. We're waiting to see if there will be, an uptick in numbers, or if cases will gradually fall and therefore flatten the curve. And we'll also be monitoring whether or not more cities in Iran move from the red and yellow zones to the white zones or vice versa. And in summary for the region, I think it's important to reiterate that these scenarios, they're not black and white. There's no perfect fit for a situation as unprecedented as the COVID-19 pandemic. And it is difficult to truly provide an accurate assessment. Ultimately, we believe that the COVID-19 pandemic will likely alter the contours of the Middle East and North Africa region's security environment and will pose challenges in terms of food security, conflict resolution, geopolitical tension, and terrorism in the near to medium term. COVID-19 has also significantly degraded the tourism sector upon which many countries in the MENA region heavily depend on, such as Jordan and Egypt. And the remittances that these countries usually benefit from have also been heavily impacted by COVID-19. So the trends that were already at play in the region, such as nationwide protests in various countries such as Lebanon or Iraq, US-Iranian tension, and the resurgence of the Islamic State will likely accelerate.